coronavirus really hit close to home for Minnesota Senator and former Democratic presidential candidate Amy Klobuchar. She recently shared her own story. Her husband, John, was hospitalized after he tested positive. Senator Klobuchar is joining us now. Senator, good morning to you.
Well, thank you, Craig. Thanks for having me on, and thanks for sharing all of this information with the people of America. I can't tell you how important it is for people to get the truth about how serious this is.
Let's start with your husband. How's he doing? I know that he's since been released from the hospital, but I understand that you guys are still living separately. How's John?
Well, yes, we're living separately only because they're not sure if he is still contagious or not. So we haven't had the green light. As you know, this is a long disease, but he's much better than he was in the hospital when he had severe pneumonia and was coughing up blood and had really, really low oxygen. So they had him on oxygen for 4 or 5 days. So we're just so happy he's back. I've been waving to him out the window, staying at a friend's apartment nearby, just ate her last frozen burrito this weekend. So venturing out. But our story actually, Craig, is like so many others. And I think every family in America is going to know what this is like. And I think it's important to share. You can't go visit your loved one. You can't hold their hand. You can't meet the caregivers and give them a hug for taking care of him. All you can do is talk to them on the phone. And one of the important things I learned from this that I will pass on is one, following the rules. When he thought he just had a cold, he stayed in the apartment and he stopped from spreading it to a lot of other people. Secondly, it is checking up on people over the phone or Skype, because that's what I kept doing. I'd say, what's your temperature when he was home alone? What's your temperature? Because people can get a little loopy when they have high temperature day after day after day. And you really have to check in to help them decide when it's time to go in. And so I just want to thank all these ordinary people that did extraordinary things for him. And so many, when I saw those people on your clip building the tents, when I see the grocery clerks where I am right now, it's just an extraordinary moment. Yeah. And as hard as it is, we have to remember that.
Senator, there has been a bit of an increase in testing in our country, thankfully, but there's still not enough tests. You've spent a lot of time talking about that, but you've also spent a fair amount of time talking about the need to test people to see if they've had the disease before, if they've had the virus before. Why is that so important?
Well, I want your viewers to think about this. Everyone wants to know if they have it right now. That's why we have these testing guidelines. I was personally never tested and I didn't want to be, because I never had symptoms, because the minute he started getting sick, I was in Minnesota and we stayed separate. But what we ultimately want to have is testing available to everyone. And here's the key, as you just said, being able to know if you had it in the past and you just didn't have symptoms, and if you have immunities to it and antibodies. And then you could give blood to help others, but you also then could go to work, and once the work opens in some way, participate in the economy. It would be a game changer. And Mayo Clinic in my state is very close to putting that test out, as are many others. It's usually going to be a blood test and with quick results. That is a big deal when we get to that moment, Craig. And that's why I've been pushing so hard for FDA approval and for helping get this. So there were big mistakes made at the beginning. We all know that. There's going to be plenty of time to relitigate this about why we didn't get tests out in America while this was expanding in China. But right now, we must look forward and get those tests out so we can make people healthy and get the economy moving.
Senator Amy Klobuchar, it's good to see you. Glad you're doing well.
Okay.
Glad John is on the mend as well. Senator, thank you.
Thank you so much, Craig. Thank you.